Hello, everyone. Welcome to a podcast by Verve Labs AI. I'm Vinay Iyer, and I'm excited here today to have Dr. Murali. Dr. Murali is a dentist in Bangalore, India, and he is one of our very first customers to try our AI agent. Dr. Murali, welcome, and we would love to hear a little background about yourself.
Vinay, it's a pleasure to be interacting with you in person, virtually though. Yeah, for a person who has never adopted internet on the form of a website or anything, the AI agent seemed to be a very interesting concept where I didn't have to spend too much time, effort, money on setting up a website and getting it run, maintain, and pay all kinds of annual charges, etc. So this seemed pretty interesting, and I'm sure there are a lot of dentists who are looking forward to something similar where they can make it easy and straightforward. Thank you.
Excellent, excellent. Yeah, we are really excited that you have deployed the AI agent and found some interesting uses for it as well. So, could you give a little background about how you have been attracting patients to your clinic and typically what happens when somebody tries to contact your clinic?
Well, I've been an old timer. I've been in practice for more than 25 years now. Traditionally, it has been a word of mouth kind of a practice, although we keep thinking about having a presence online and things like that, it never materialized. And with the AI agent now, the presence is felt more on the internet. And to promote this, I had put my DP on WhatsApp as my QR code that was provided by the agent. So it did draw a few people to find out more about it. And once they either click on the QR code, they get to know more about my clinic, my practice, my working hours, and they could either come up with a question or try and schedule an appointment. And I get an email notice or a prompt, and that's how I interact with the potential customer. And also sometimes I get a message on WhatsApp and I'm able to communicate. All this was not possible earlier.
Oh, excellent. So, you use WhatsApp and SMS messaging as the primary ways of engaging with your potential patients and maybe even current patients.
Yeah, apart from phone calls, in India, WhatsApp is becoming more of an official communication tool. And in fact, some of the regular telephone or the mobile providers also use internet for communications and network connectivity. So yes, WhatsApp is becoming a very popular tool for even official purposes, and it's very easy to download an attachment or a photograph or any communication that I may want to have with my patient. For example, if you want to share an X-ray, all they have to do is take a picture of the X-ray and send it as an attachment, and I'm able to view it almost instantly. So yeah, a lot of communications happening with WhatsApp nowadays.
So for you to be able to share a link or a QR code to the AI assistant that can answer on your behalf has been a big help. Is that?
Yeah, it does. And in case when I'm busy and I'm not able to answer the phone or I don't want to lose out on an information that I need to provide a patient, and sometimes to give instructions post a procedure or a surgery or something, it helps a lot to give a standing set of instructions which they can open the AI tool and then get the information. And if they still have any queries, they can always message me and I can get back to them. So that helps a lot.
So, so I assume it's saving you quite a bit of time and also preventing people from going away because they can't reach you because now they can get the information they want just by interacting with the AI assistant.
Yeah, that's right. And for me, the most important thing is that post any procedure, if I want to give some instructions, and many times we do give the instructions verbally, but then the patients are either apprehensive or they are in a hurry to leave and they may not follow the instructions thoroughly. So when it is in the printed form or it's available there, they can read it, they can maybe if they want, they can print it out and save it for future. So that helps a lot. Also, we are trying to see, I've already interacted with you a couple of times, and we are trying to see if a patient consent form can be done online, and also a pre-visit questionnaire regarding the health and other details of the patient can be recorded and saved. So that saves us quite some time. And also, I can review the patient's medical history before they come to me. So I'm prepared to know what kind of other general health issues the patients may have. So
Oh,
that's
excellent.
something that I'm looking forward to incorporating into this AI so that it makes it that much easier for both the patient as well as for me to access.
That's wonderful. So not only does the AI provide information, but it also provides easy links to forms that you need, like the intake form, the consent form, and so forth, so that patients can fill them out before they come to the clinic, or while at the clinic, you can just pull them up online and get them filled out. So you don't have to worry about printers and paper and ink and all those problems that.
Yeah, the biggest challenge, sorry to interrupt you. The biggest challenge is to save all the documents and file them. And then, sometimes a patient visits me after 5 years. Then it takes a lot of time and effort for me to retrieve the old file.
Mm,
So, if it happens online and where we have a particular ID for the patient, all I have to do is probably click the name or the number, and then we are able to retrieve the information. Makes it a very big advantage. And also, many times, what happens is we have prescriptions for the patient who is having different health conditions. And many times, we don't know what the composition of the tablet is. As you may know, India has a huge pharmaceutical manufacturing units all over the country. And we have perhaps the maximum number of combinations of drugs. And just looking at the name, I may not be able to understand what exactly it contains. For example, along with medicine meant for hypertension or blood pressure, they may incorporate a blood thinner in it too.
oh, wow.
Blood thinner is a potential danger for us because if we do a procedure where there's a little bit of blood involved, it may lead to excessive bleeding.
Mhm.
So we have to make sure that the patient is not on blood thinner, or if he or she is, then we have to compensate for it. So these kind of informations, if the patient is able to send me the prescription in advance, I can go through what medication the patient is on, do my homework better, and that way I'm ready when the patient comes for treatment.
Excellent, excellent. Well, we are really excited to continue to evolve our AI assistant to help you more and more. So, thank you for all your feedback, and thank you very much for being our first customer and giving it
Wow.
a try. I also appreciate the fact that you have referred us to a number of friends or fellow dentists in your network, and they have been excited to give us a try as well. So, we really appreciate it. Thank you.
Yeah, thank you. I appreciate it. And as I said, we dentists generally don't have a lot of time. And between patients, we may not have that much of a time or the energy to keep switching from internet to a online portal or something. Whereas if these things are available on the mobile or something, that makes life that much easier. And I
Mhm.
think this is where the AI agent is going to make a big difference, where it's generally more easy to access than every time having to open the website and then update information and things like that. So I'm really excited. Thanks for the opportunity, and we look forward to more innovations that can make our lives that much easier. Thank you.
All right. Thank you, Doctor. Have a good day.
Thank you.